Hi, I'm Niamh Heenan and I'm a specialist respiratory dietitian. Over the last few months, I've been working primarily on the respiratory wards, focusing on the care of patients with COVID-19. And I'm here with my colleague, Amy.
Hi, I'm Amy Hallhouse. I'm a senior specialist dietitian leading the adult critical care team covering both sites across City.
We know that good nutrition is vital in giving our patients the best chance of recovery. Good nutrition helps our immune system respond appropriately to the challenge of infection. It increases the likelihood of good outcome and tolerance of treatment, and it can promote recovery and reduce the long-term effects of COVID-19.
Multidisciplinary team working is key when tackling malnutrition across all settings. All team members should consider, assess, highlight and treat malnutrition right through the patient's journey, from admission to rehabilitation. We have encountered a number of challenges within those diagnosed with COVID-19. Nutrition and hydration is a key pillar in patients' care and everyone's responsibility, and we hope that you'll feel empowered to make an impact.
Identifying the risk of malnutrition in patients with COVID-19 can be complex. Patients may not look malnourished. Being overweight or obese can mask malnutrition, and unplanned weight loss can be harder to detect. Social isolation and anxiety are common and can negatively impact a person's nutritional status and well-being. Younger patients can also be at risk, especially if they have a long-term condition. You can help by ensuring that when undertaking nutritional assessment and screening, you take the time to consider what the patient's nutritional history or background is and assess whether any symptoms or treatment is impacting on the patient's ability to eat and drink enough. Even when patients are in the healthy or overweight BMI category, it is still important to consider any unplanned weight loss and symptoms that are affecting their intake.
Many symptoms and treatments impact on a patient's ability to eat and drink enough. Patients requiring increased oxygen therapy are highly likely to have reduced food intake for a number of reasons. Patients are presenting extremely breathless, some with a persistent cough and a loss of taste and smell, with some reporting loose stools, extreme fatigue, and in some settings, patients are required to lie face down for a number of hours to help manage their oxygenation, a treatment called proning. The COVID nutritional care plan should be started for all patients with COVID-19. This will ensure that patients at risk are highlighted and are started on the correct oral nutritional supplements if they fall within the medium or high risk group. Explaining and involving patients in the decision to start oral nutritional supplements helps to ensure they are on board with their treatment plan. Key message posters are available to educate and support staff to help support our patients.
Infection control measures in place limit the number of visitors, volunteers and staff contact, which inadvertently affects patient-centred care. This can impact patient engagement and motivation, particularly when patients are unable to see family and friends for long periods of time. You can help by making sure that every contact counts with respect to nutrition and hydration. This can be as simple as offering a patient a snack or drink throughout the day. Ward staff should also provide patients with the COVID-19 nutrition information leaflet and direct family or carers to online resources so they can support remotely.
One of the key challenges that we are facing is the timely and appropriate insertion of nasogastric feeding tubes. As patients become more unwell, the placement of tubes becomes more difficult and in some cases near impossible, as the patients are unable to tolerate time off their oxygen support for their tube insertion. Discussing the possibility of nasogastric tube with patients who are on 40% oxygen or more, or who are managing less than 50% of their meals is current guidance. What can you do to help? Use the COVID-19 nutritional care plan, food charts and discuss proactively with the MDT. For all patients, it helps to consider and identify if they will benefit from nasogastric feeding as part of their treatment plan. Explaining to patients why this will aid their recovery will ensure they are on board with their nutritional plan. Many of the nutritional challenges our COVID-19 patients are facing on the ward continue in the critical care setting. Patients are likely to have an extended period of time at home or on a ward with reduced oral intake, making them high risk of malnutrition, so it is key that we establish appropriate nutrition as soon as possible. The high levels of oxygen therapy make it very difficult for our patients to have adequate oral intake. A high number of COVID-19 patients, whether they are awake or intubated and ventilated, are proned in the critical care setting. The process of proning and deproning causes short breaks in feed delivery. For patients who are eating, few manage to eat enough when lying on their front for extended periods of time. We see a higher number of patients struggling with gastric residual volumes and delayed gastric emptying. This is typically a result of high levels of sedation, pain relief and paralysing agents alongside possible delays in starting appropriate bowel management. We want you to feel confident in helping combat these barriers. Without nutrition, their weaning and recovery will be negatively impacted. To give our patients their best chance of recovery, you should consider the patient's nutrition and hydration in your daily cares and ward rounds. Not only is the patient eating, but are they eating enough? Highlight and discuss with the dietitians around the decisions to place a nasogastric feeding tube. These patients are more likely to need a nasogastric tube than not. Implement the COVID-19 critical care enteral feeding protocol. Initiate the bowel management and critical care protocol in a timely manner.
On step down from ICU or HDU, patients remain nutritionally vulnerable. Many will have only had minimal amounts to eat or drink throughout their stay in critical care and will still have a nasogastric tube in place. Although the patient has made a positive step in their recovery, they are not at the end of their recovery journey. Therefore, before nasogastric tubes are removed, it is important to assess whether the patient can eat and drink adequately to meet their needs. Ensure you contact your ward dietitian prior to a nasogastric tube removal. COVID-19 can have long-lasting effects. The best recovery and rehabilitation relies on a number of factors, including good nutrition. Discuss with patients that optimising their recovery and achieving long-term well-being goals requires good nutrition and hydration. Provide nutrition information, signposting and support at discharge. For patients with COVID symptoms continuing beyond 12 weeks, their GP can refer on to the Leeds Long COVID-19 service.
We hope that you have been inspired from this short learning burst that good nutrition is vital. Everyone can play a part in helping to ensure the best nutrition care and treatments for our patients. Please share your learning with patients and colleagues. All the resources to help you and your colleagues provide the best nutritional treatment and care for our patients can be accessed via the Trust intranet page.
If you have any questions or ideas, please contact the department or discuss with your ward dietitian. Thank you for listening.